Welcome to the ankle and foot presentation on the joints. You do need to know and understand all the joint structures of the body in order to be able to learn about the muscles and how the muscles work and to do the specific muscle tests. So this presentation is going to include the bone structures and points of attachment, as well as covering the ligaments of the ankle and foot and the bursa and the tendons. So you do need to be able to demonstrate and palpate the different joints so that you can show the examiner, if she requests it, all the different bony landmarks. The examiner will expect you to be able to audibly explain and demonstrate palpation. So it is worth you practicing the names of these joints and names so that you can practice them out loud and be quite happy discussing these terms. So if you repeat after me, talocrural joint. The talocrural joint is formed by the tibia, the fibula and the talus, and where they articulate with one another, they form a hinge joint. So that helps us with dorsiflexion, and dorsiflexion is when you bring the toes towards the shin or towards the knee, and plantarflexion is when you point your toes away. So the talocrural joint is made up of the tibia, fibula and talus, and it helps to perform the action of dorsiflexion, plantarflexion, and forms a hinge joint. The other bony landmarks are the malleolus. We have a lateral and medial malleolus, and that is really the ankle bone, is the malleolus on the medial side, which is the end of the tibia. We also have the lateral malleolus, which is on the outside of the ankle, and this is formed by the end of the fibula. Sustentaculum tali. This is a horizontal shelf which sits about an inch below the medial malleolus of the calcaneal bone. It can be easily palpated, and on the next slide I've got a video of a lady explaining how to do that. So repeat after me, sustentaculum tali. Repeat after me, peroneal tubercle. The peroneal tubercle is an area on the foot, on the outside edge of the foot. So if you run your finger about halfway down the lateral edge of the foot on the little toe side, you'll find a little bump there, which is on the 5th metatarsal. This is the peroneal tubercle, where the peroneus brevis and longus attach. As they contract and pull on the 5th metatarsal, then the foot will pull up and form an eversion movement. So the peroneus longus and brevis is the action of those muscles is to plantarflex and also to evert the foot. So that's the peroneal tubercle. So we're also going to learn about the navicular tubercle and the talar dome. The navicular tubercle can be found on the medial aspect of the foot. So if you run your finger from the ankle bone on the medial side, ankle malleolus, you can feel the navicular bone, a little bit more inferior to the malleolus. The talar dome is the shape given to the top of the talus. So it's a dome shape where it articulates with the tibia bone. So we're going to refresh our memory The ankle bones are the tarsal bones. There's 7 of them. The heel bone is known as the calcaneus. The weight-bearing bone is the talus that articulates with the tibia and the fibula at the side. In front of the talus is the navicular and the 3 cuneiforms. Beside the cuneiforms, in front of the calcaneus, is the cuboid. So there are 7 tarsal bones that form the ankle. So repeat them after me. Tarsal bones, calcaneus, talus, navicular, cuneiforms, and cuboid. So as well as the 7 tarsals, you also have 5 metatarsal bones on the foot and 14 phalanges. So 7 tarsals, 5 metatarsals, and 14 phalanges on each foot. So building on the bony landmarks, we need to now understand the soft tissue of the ankle and foot. And we have several ligaments, the Achilles tendon and the plantar fascia membrane that we need to be able to find and pronounce. So repeat after me these names. Anterior talofibular ligament, calcaneofibular ligament, posterior talofibular ligament, the Achilles tendon, the deltoid, which is a medial ligament, and the plantar fascia membrane. So these do say and do what's written on the tin. So the anterior talofibular ligament is anterior, so it's going to be on the front. It's going to be a tiny ligament that goes from the talo bone, the talar bone, talus bone to the fibula bone. The calcaneal fibular ligament goes between the calcaneus and the outside edge of the fibula. The posterior talofibular ligament is at the back, so posterior is going to be at the back. The Achilles tendon, we know, comes down from the soleus and the gastrocnemius and attaches onto the calcaneal bone by the Achilles tendon. The deltoid ligament is on the medial aspect of the foot, and the plantar fascia membrane is what forms the arch underneath the foot. I've just had plantar fasciitis the last year, and it is the most painful thing of all. But actually quite interesting is apparently the plantar fascia is normally about 1 millimeter thick. But on the ultrasound that I had 7.5 millimeters of fascia with inflammation. So it's very painful. It becomes very thickened when you have plantar fasciitis for a long time. So the plantar fascia is the plantar fascia is underneath the foot, forms the arch of the foot. The deltoid ligaments are the medial ligaments, and there are 4 medial ligaments. And these are made up of the posterior tibio-talar ligament, the tibio-calcaneal ligament, the anterior tibio-talar ligament, and the tibio-navicular ligament. So they're all on the medial aspect of the ankle, and this is where the talocrural joint is, and it's a long, strong, flat, sort of triangular band of ligaments. So repeat after me: posterior tibio-talar ligament, tibio-calcaneal ligament, anterior tibio-talar ligament, and the tibia-navicular ligament. So as I said, this is a strong, flat, triangular band of ligaments to be found on the medial side of the ankle. We have come across the retinaculum before on the wrist and the ankle, and this is a reinforced thick fascia that helps to bind the blood vessels, nerves and tendons close to the bone. Otherwise they would stick out, they'd get caught as we got older. So this binds them against the bone as a strapping. We have superior, inferior, extensor, flexor, lateral, posterior and peroneal retinaculum. So repeat after me the term retinacular. And finally, we need to know the bursas that can be found in the ankle and the foot. So a bursa is a synovial sac filled with synovial fluid, and it cushions between either two bones or tendons. And we have a couple of bursa on the foot that we need to know about. We have superficial Achilles bursa and the deep Achilles bursa. Now, I've had bursitis as a child on the back of my heel, where it kept rubbing and it became inflamed, which was bursitis. So the superficial Achilles bursa, as you can see, is right sitting superficially on the bone, whereas the deep Achilles bursa is underneath the tendon, and you can't really feel it or palpate it. But they're very painful if they become inflamed, which is bursitis. So repeat after me: superficial Achilles bursa and deep Achilles bursa.